Madam President, the majority in this chamber has spent countless committee and now session hours on things that may or may not happen. Things we as state legislators have no control over. Meanwhile, a very real, ongoing crisis that we do have control over goes on. Patients, many of them children, in Michigan psychiatric facilities continue to be mistreated. And their families say their concerns aren't being heard. Patient escapes, traumatizing emergency simulations, violent attacks, multi-million-dollar lawsuits, recipient rights complaints going unanswered. Or the complaint is answered and verified, yet no disciplinary actions against the state employee occurs. I have been stonewalled when seeking answers from the department in charge of our facilities. This majority would rather protect the department than protect patients' rights in our own facilities. I've asked for the independent audit of the Office of Recipient Rights that is ongoing as we speak. I've introduced legislation to provide greater oversight, transparency, and accountability for patients seeking mental health care. Earlier this month, the House version of the same legislation was approved unanimously in committee. Protecting Michigan's young and vulnerable mental health patients is not and should not be a partisan issue. This is why I again call on the Committee on Housing and Human Services to take up Senate Bills 142 and 143. We share a duty to protect Michigan's most vulnerable residents by providing leadership and proper oversight where it is lacking. I urge the majority to stop using committee time on issues that may or may not happen and instead focus on fixing real problems right here at home.